Welcome to our caregiving presentation, in which we'll be talking about caring for yourselves as you cope with the stresses of caring for others. My name is Dr. Penny Stern, and I am the Chief Preventive and Lifestyle Medicine at Northwell Health. I'll be serving as your moderator. Our expert panelists are Dr. Jill Sonnenklar, Senior Psychologist within the Northwell Health System. Her role in the Division of Developmental and Behavioral Pediatrics includes providing individual, family, and group therapy to children, adolescents, and adults. And Dr. Donna Seminara, a board-certified internist and geriatrician with over 25 years' experience in private practice. She is the Director of Geriatrics at Staten Island University Hospital at Northwell Health and Medical Director of the Egger Healthcare and Rehabilitation Center. Thank you both so much for being here today. So many of us are trying to juggle a multitude of duties, including work responsibilities, family life, the needs of children, parents, spouses, partners, friends. Caregiving can be a challenge. So I'd like to start by asking you, Dr. Seminara, what do people need to think about as they approach the role of caregiver?
I do think that it's very important as we accept the role of caregiver to recognize all of the external pressures that we have. Certainly, you're providing care for a person, you're providing care for your own family, and you may have other obligations for those in generations above and behind you. In order to keep yourself in the best shape possible, it's really important to prioritize your own health so that while you're in the midst of providing care for others, you're not worried about your own care. So, number one, it's so important to have a good relationship with a primary care physician with whom you can reach out and contact should you develop trouble. The important thing while you're the sandwich generation is to make sure that you yourself are being protected from things that can interfere with your ability to provide care. This can start with healthcare assessments for cancer screenings. Women should be getting pap smears as indicated by their gynecologist and based on their own gynecologic history. Mammograms are absolutely in order, and for most of caregiving age, this may be being done on an annualized basis. Indications for colonoscopy have recently changed so that colonoscopy screenings now actually start at the age of 45. Some women may be predisposed to early onset bone loss and may require DEXA scans before menopause, although most will require them afterwards. And it's very important at this time to do an honest assessment for your own cardiovascular risk. Unfortunately for women, sometimes the preeminent presenting symptom is sudden death. So if you have underlying cardiovascular risk with high cholesterol or hypertension, being overweight or a diabetic, it's time to start to manage those risk factors now and perhaps get yourself screened for a good cardiovascular assessment. Another system that we don't always think about is that of oral care. When you're under stress, underlying pathologies with gingivitis may flare and be very disruptive in your ability to provide care. So that's an important screening assessment that I think we often forget about. Now there are the other social factors related to health. What is your weight at and how should that be optimized? Are you an exerciser or not? If you're a smoker, have you done the appropriate cancer screens for smoking with a CAT scan of the chest and sometimes an analysis even for bladder cancer? Of course, stopping smoking would be the best thing of all. Recognizing that that's difficult, any amount that you can decrease will benefit you. And you certainly don't want to be exposing the person for whom you're providing care with secondary smoke. Alcohol should be limited, and of course, recreational drugs should be completely avoided. These are some of the basics, but if we don't address them for ourselves, it can be very difficult if they flare emergently when we're providing care for others who are dependent upon us.
That was great. I'm a preventive medicine specialist, and I absolutely agree with the centrality of screenings as part of health maintenance. And we're living, especially now, in unusual times, more than 2 years into this pandemic. So what's your advice, Dr. Seminara, as to how, as caregivers, to avoid bringing infectious disease into the home, how to protect those you're caring for during pandemic and also in general?
Well, this is a very hot topic, as you can imagine. And as an administrator for a home visit program, it was particularly tragic for me to see homebound patients develop COVID. The only way that they got it is that their caregivers and their home health aides brought it into them. And that's a very tragic situation. So without looking to spend the hours on COVID that we could, we certainly are all aware now of the 2 messenger RNA viral vaccines that are available with Pfizer and with Moderna, separating the primary immunizations by either 3 or 4 weeks. Also, there's been a lot of publicity about the need for subsequent boosters, a first booster being done after you've hit about the 5-month mark now after having had a primary immunization. Secondary boosters are also being offered, and I think the indications for the why and the when should be individualized for the patient. We have so many people in our own clinics now who've had COVID recently in between getting primary vaccines and secondary boosters. So there are a lot of factors that may go into the timing of this, but there's no doubt that immunizing the patient at home is essential, as well as all of the caregivers who come in contact with the patient. One cannot assume that just because somebody is being hired through an agency, that they have been appropriately treated with vaccines before coming into the house. So that's an important question to ask when you're working with a home care agency. Now, all of the other immunization schedules are also important. So for instance, annual flu vaccines are very important. We know that influenza can still occur even if vaccinated, but in general, as with COVID, the side effects are usually less intense. Hospitalizations and deaths can be avoided by being appropriately immunized. Furthermore, for pneumococcal infections, this is a bacteria from strep pneumonia. This can be a very devastating infection, not only for immunocompromised persons, but for healthy persons as well. And the indications for immunization here have also very recently changed so that we now have a Prevnar 20, which is a pneumococcal 20-valent conjugate vaccine, which can be given once after the age of 65, and then that would be it for needed coverage. There are, however, other options using a Prevnar 15 followed a year after by pneumococcal vaccine, Pneumovax 23. The appropriate choice really should be made based upon the individual's previous immunization history. And again, conversing with the PCP for yourself and for the person you're caring for can help point you in the right direction. One thing that COVID did, I find, particularly for my older patients, is that it made them much more aware of the availability of these vaccines and also vaccines for shingles. I've never seen so much interest as I have now in the shingles vaccine. And we now have Shingrix, which is a 2-step vaccine, each administration given within 6 months of each other. And that can be purchased at pharmacy and is available for all for whom it may be appropriate. Another vaccine to keep in mind for caregivers who are grandparents and caring for young grandchildren is the Tdap, where they can get coverage for tetanus and pertussis. And pediatricians are very good at telling young parents about the need to get the grandparents immunized for this. So immunizations, very important. And the most important other thing is good hygiene. You've got to wash your hands frequently when you're caring for a person who's got multiple comorbidities or who is immunocompromised. Wearing a mask so that you're not sharing germs, using gloves, especially when you're dealing with cleaning patients who may be soiled, when you're handling soiled materials, is very important to limit contact to yourself. And I do have several families, and I have done this myself when caring for those who are elderly in my family. If I'm going to visit them and I've been out in the office or the hospital, I completely change when I get to the house. I shower, I wear a mask and gloves because I don't want to contaminate them and bring them anything that I may have been exposed to. I don't want to be a passive carrier. So these are different extremes of what is needed and necessary, but a good conversation with your with your own doctor, and then also with the PCP for the person you're caring for, will give you good individualized guidance on which of these recommendations would be most important for you to follow.
That was great. Just one more thing. Can you tell us more about making the environment safe for those we care for as well as for ourselves?
I never learned so much about the environment of care until I started to do home visits myself. And I frequently saw where things broke down when I went into the home and learned about the home environment. One of the most important things really to see is, where does the patient sleep? Does the patient sleep in a regular bed, and is that bed appropriate for them? If they bought a California King 10 years ago, it just may be too high for them to be able to get off of safely now. So sometimes mattress heights need to be adjusted. For many patients, however, who have multiple comorbid illnesses, it's really best that they have a hospital bed. There are hospital beds that have cranks to elevate and to lower different parts of the bed. An electronic bed is, of course, the easiest, because you can easily raise the head of the bed, raise the legs of the bed, and this is very helpful. Having side rails at the top of the bed allows the patient to be able to rotate appropriately, so that if they need to be rotated so that care can be given to their back, using side rails as a lever is very helpful and important. And for patients who are primarily bedbound, they should have a specialized mattress to avoid complications of pressure injury. If you have someone who you're caring for who already has a pressure injury or an ulcer, it is absolutely imperative that they are on a mattress that helps to alleviate that pressure. There are egg crate mattresses, airflow mattresses, and these are very readily available and ordered easily by a physician prescription. It's important to learn how to rotate the patients in bed to decrease the risk of pressure injury. So knowing the type of bed that the patient is on is important. Seeing that it's appropriate for their level of function is vital. And also, even if you see a bed, ask if that's where the patient actually sleeps. I'm amazed how many people actually sleep in recliner chairs. They sit in them during the day and they live in them at night. Some of them are excellent. They really allow for significant change in body position for the patient so that they can be fully recumbent and even have their legs elevated while in the recliner. The recliners come in sort of fashionable cloths and artificial leathers so that they can be positioned in a family room, so the patient is socialized with the family, which I think is so important. And they are generally very comfortable. Also, for particular disease processes, you can get electronic chairs that will actually take a person from recumbency and get them fully upright. So for Parkinson's patients, this can be particularly helpful. Using bolsters in bed can help to elevate legs if they have edema problems, can help to enhance breathing by elevating the head of the bed or the recliner. So it's important to see how the patient uses the equipment that they sleep in and be sure that they're using it appropriately. Another area that's very important in the environment of care is decreasing the risk for falling. The number one room is the bathroom. Patients go in, and a very typical scenario is they'll turn on the hot water to get ready for a shower and then go sit on the toilet. And while sitting on the toilet, they may drop their blood pressure if they're straining to defecate, or sometimes even the process of urination can drop a blood pressure. Then they stand up and the room is starting to get foggy with mist. The walls are getting wet. The floor tile is wet. It's a very dangerous situation. And I'm sure if you all think about it, you know someone, and maybe it's you, who reaches over the side of a tub to hold onto the soap bar, the soap dish, and uses that to balance yourself stepping over into a tub to a shower. Stepping over the tub is a primary way that frail elderly persons will fall. If one has the economic means, the safest thing to do is to put in a walk-in shower. Walk-in showers are very easy. You can actually bring a wheelchair right into the shower. You can transfer a person right onto a very inexpensive plastic chair. so that they can have some control in the showering process, also with a handheld shower head. This is so important. Having grab bars up, very important. And almost all contractors are now used to converting bathrooms in this manner. So it can still look non-institutional, so to speak, and be functionally very appropriate and safe for a person who's going to be using the space. Other things in the environment, enhanced lighting, making sure that the ambient temperature is appropriate. These are all, very important aspects of the home environment. And when I'm in the house, I also look at the durable medical equipment that's being sometimes used and sometimes stored in the house. I'll see wheelchairs in the corner with cobwebs on them. I'll see lots of canes and lots of walkers sort of piled up. And when you ask the patient how they get around, they may not be using any of it. And they just walk from furniture piece to furniture piece. There may be too much clutter. Clutter is a big problem in terms of risks to fall. Sometimes I've walked into homes where there's overt hoarding, and the hoarding, aside from its own pathology, certainly provides a lot of health risks for patients based on how orderly. I've been to very orderly hoarder homes, and I've been into some very unfortunate environments where there are very obvious infectious risks as well. Seeing all of that can cue me into other social challenges of the patient. Sometimes I have a better insight into the actual poverty of a patient when I'm in their home. Sometimes I'll ask for a water and they'll open the refrigerator door and I get to eyeball, is there food in there? What types of things are in the refrigerator? And I can make offers for food supplementation with Meals on Wheels programs, for instance. So doing a home visit has really opened up for me the tremendous value that can be gotten by seeing where and how a patient lives. And when you go to care for someone in your family, could be someone who you haven't been in their home for quite a while. And it can be sometimes alarming and upsetting. But with that insight, the important thing is not to challenge the patient, but help them to manage and make their environment more healthy for them. And it's a process. You can't change things very quickly. I've gone into houses, moved the kitchen chairs to make it more spacious, appropriate, and then I go back and everything's, back the way they really want it. So you have to take your time with it, but there's a lot to be learned by visiting patients in their home.
And that was great. So many external environmental aspects to consider. Dr. Sonnenklar, can you give us some guidance as to the internal coping skills that we can sharpen? We've talked about the external environmental aspects. What are some of your favorite coping skills and why?
Sure. First of all, those were some wonderful suggestions just to keep our environment around us safe, very, very important. But it's also important to make sure that we're feeling okay on the inside as well. And there's lots of good coping skills out there and lots of good skills that can help us calm down, get through difficult moments. People have their favorites. What I tend to do when working with people is I tend to throw out a lot of them, and some will stick and some won't, and that's fine. People find their favorites. I personally love deep breathing. There's lots of different ways to do it, but it's important that you do it low from your belly and slow. And that's a quick and easy way to just kind of catch your breath literally and calm down. There's many different relaxation techniques. There's visualization where you basically imagine your favorite place and use all your senses to kind of conjure it up. So for me, it's always the beach, and I'm imagining what I see, what I smell, and like maybe what I'm touching, like the sand underneath my hands. And you use all the senses and just kind of conjure up that image and just give yourself a little bit of a break, even for 30 seconds, just by transporting yourself to that place. There's self-statements. Those are things that you can say to yourself, and everyone will find their favorite. Something like, I can do this, I'll get through it, I can handle it. There's things like distraction, and we use this all the time. And we all use our phones for distraction. I mean, think about when you're waiting online for anything, everyone's always on their phone. And that's a way to kind of distract ourselves to get through the moment. And that's fine. There are things like self-soothing, just taking care of yourself. And often those involve your senses as well. It might be drinking a nice hot cup of tea. It might be something like petting your cat, again, using your kind of senses to soothe yourself. And there's also mindfulness. There's a lot of research about the effectiveness of mindfulness. It's been shown to decrease anxiety and decrease depression, help people be more focused, be more present. I can go through a whole slew of different mindfulness exercises, but they're all out there on the internet, so you could find your own favorite. And you asked, why are these my favorite? I would say because these are exercises, these are things that you can do anywhere and no one will know. And that's so important because you need to use these tools whenever you can, whenever you need them. They will work, but I will say one thing is that they work when you practice, when you know what you're doing. So some people expect, okay, you've taught me all these skills, and then they're in an anxious moment. All of a sudden they're like, but I'm trying to visualize and it's not working. No, it doesn't work that way. You have to practice visualizing during a calm moment so you're able to do it. And then when you're in the stressful situation, it will work. So practice is important.
Oh, that's great. What do you say to the person who will tell you, I know relaxation is helpful, but when I have to work deadlines and I have kids to take care of and everything else, I don't have the time. What can I do? What do you say to them?
Yeah, no, it's so hard to find the time. Everyone feels that way. You feel like you're doing so many things at once, but you could find the time and it's important to do it. And there are some very quick relaxation tools. One that I love doing myself and teaching my patients to do is something called squeezing lemons. And that's just where, you just imagine there's lemons in your hands and you're squeezing and squeezing, and you imagine like the juice dripping and you imagine the smell, and you squeeze for like 5 seconds and then you drop it. And your hands feel all light and tingly. And that's a relaxation technique. If you're standing there like this, people are going to notice it. But if you're putting your hands on your lap and doing it, no one's going to notice. So that's something quick that you could find time to do. But I think the important thing is to fit these techniques in whenever you can. Deep breathing you can do whenever you can. Yes, clearly with the kids that I work with and adolescents, when they're going into a stressful test, take the first 3 seconds and just deep breathe. It really makes a difference. When they encounter a question that they're not sure what the answer is, take a second and deep breathe. When your boss calls you into the office, take a second, deep breathe. And I also tell people to do that whenever they can. Like if they're at a red light, breathe. That's a good time for you to breathe. Recently, I've noticed myself when I'm in the kitchen and I'm heating up my coffee and I put it in the microwave for 30 seconds. I notice that I say to myself, okay, my coffee is going to be in there for 30 seconds. What can I do? Can I wash some dishes? Can I cut some vegetables? And now I'm saying to myself, you know what? It's 30 seconds. I'm going to take those 30 seconds and just be and just breathe and just relax. And so there are times like that if you work it into your day, you can find the time to just use some of these techniques.
Oh, that's incredibly helpful. I appreciate those tips. Dr. Seminara, when the caregiving is for an older person who has certain limitations, shall I say, how can a caregiver handle the frustration that comes with elder care as opposed to with younger folks?
Sure. So I think one of the most important things that caregivers need to learn, and it's a process, is that there's a difference in caring for everyone else versus those who are most senior, okay? They really are dealing more with geriatric syndromes, and those syndromes affect their health and their function to a much greater degree than the diagnoses that they've been carrying for decades. So it's less important to a person who's 85 plus, let's say, what their LDL, bad cholesterol is versus are they sleeping? Are they able to have regular bowel movements? What matters to them? In fact, an age-friendly health system is really oriented around the 4 M's. And the 4 M's are what matters most, mentation, medications, and mobility. So very quickly, for medications, polypharmacy is a very big risk for older persons. Each time they go into a hospital and they see specialists, medications get added, or they're added to long lists of medications that the patient has already been taking, often for decades. It's funny, but as a geriatrician, I sort of go in and start deprescribing. I take away and try to see what is absolutely necessary. As patients age, their body weight may change. Their percentage of body fat to muscle certainly changes, and that may change also their need their need for and the amount of medications that they take. So that's a very important thing to understand. Mobility. Is the patient mobile? Can their mobility be improved? Are they using their durable medical equipment, the wheelchairs and the walkers, appropriately? As I had mentioned earlier, the patients with multiple canes and walkers in the house, they often go out with the simplest thing, which is a cane, which actually may be the most dangerous for them because it doesn't really give them the stability that a squared walker would. So one needs to really be very careful about that. Mentation really focuses on the 3 Ds of geriatrics, which is dementia, delirium, and depression. The majority of the people who consult me directly are dealing with exacerbations of these 3 problems. And they are very significant because when patients become very behaviorally disruptive because of any of these things, it disrupts the family that's providing care for them, and it puts the patient at risk for institutionalization. It's very important as the caregiver to be appropriately observant and to describe to the PCP or geriatrician of the patient very specific examples of what you see as behavioral decline. Become a good reporter, because it's not your job to make the diagnosis, but the more clear information you can give to the geriatrician, neurologist, or internist, the more likely it is that the appropriate diagnosis will be made. And this is very important because all of the medications used to treat dementia, delirium, depression can have their own adverse side effects. So it's super important to get that down correctly. And then what matters most, if you ask the patient, they will bring up the issues that they can't sleep, that their bowel movements aren't regular, that they're frustrated by sensory impairments. And you've got to give time and attention as the doctor to those factors. Often the issues of sleep are a primary issue for the family and for the caregivers as well. And if you have an appropriate diagnosis vis-a-vis dementia, delirium, and depression, you can probably choose the best medication regimen to address the patient's insomnia. But again, it all comes down to having very good observational data from the caregiver to make the appropriate diagnosis.
Wow. So Dr. Sonnenklar, after we heard all this about elder care, what about the frustrations associated with childcare, like wishing children could be more independent, do more things on their own? What can you tell us about that?
Sure. No, it could be very frustrating. And obviously, the frustrations change according to your child's age. I think it's important that you ask yourself, what are your expectations? And that can keep your frustrations in check. Is what you're expecting age appropriate? Can your child do what it is that you're asking them to do? And there's a difference between can'ts and won'ts. So, for example, if you're asking your child to make their bed, a 10-year-old can make a bed. And if they're not doing it, they're probably being willfully defiant, or they might be willfully defiant. But if you're asking you have the same request for a 3-year-old and they're not making their bed, it's a little bit of a different story. They don't have the skills. They don't know how to do it. So that's a difference between a can't, something a child cannot do, versus a won't, something a child will not do. And if you recognize that some of these things that we're asking our children to do are actually can'ts, and if you recognize that, it might change the way you feel about the behavior or about your child. I can tell you, I often get parents that say to me, I want my child to sit through the family movie night. That's a 3-hour movie that you want your ADHD child to sit through when the child is 5. That's a can't in my mind. It's not that the child's being willfully defiant. The child physically, neurologically cannot do that. So, and sometimes for can'ts, the child doesn't have the skill. And we have to learn this, and we have to teach the children the skill. So maybe making the bed. Teach your child how to actually make the bed. It might be, doing homework independently. Your child might not have that skill. Break it up for them. give them steps, coach them, teach them how to work independently. Don't just expect that they're going to know how to do it. We might have as children, but it's not necessarily the case that our children automatically know how to do these things. I often recommend making a list for parents to make a list of things that the child cannot do versus things that the child will not do. And when I give this assignment, I say very clearly, I want one spouse to do it and the other spouse to do it, each one to do it separately. If you want to get grandma involved or the babysitter involved, fine, but each person make up their own list. And it's always amazing to me how the same behavior, one parent can view it as a can't, and the other parent can view it as a won't. And we got to work on that and come to some sort of resolution about how to view the behavior and what to do about it. So I think that when you find yourself being frustrated, ask yourself if the child can do what you're asking them to do. And obviously, if you are getting really frustrated, use some of those coping skills I talked about before, and just to get yourself through the moment. Take a deep breath. Sometimes I always ask parents, what kind of skills they do use. In every group, I run this ADHD family group. In every group, I always get a parent raise their hand, and she says, usually it's a she, white wine works wonders. And I think that we know that's not where we want to go. We want to develop more effective coping skills. But so find what skills can use. And actually, one thing that parents often say is that they find themselves yelling out of frustration. And we know that yelling isn't really effective. It just obviously increases, bad feelings within the environment, within the home. But when you're yelling at a child, I can guarantee you that the child has tuned out. They're no longer listening to the words. What they're focusing on is, gee, your face gets really red. And do you know that there's spittle that comes out of your mouth? And it's almost like steam. And that's what they're focusing on. So they're not listening to you. So I would recommend, when you do get frustrated, try some of these coping skills, try changing the way you think about it, and try to keep the emotional intensity low. That way you're going to be more effective.
So how will recognizing that it's something that a child can't do versus the won't do, how will that change the way the caregiver feels?
Yeah. Great question. I'm going to use this opportunity to give you the cognitive behavioral therapy, the CBT, in a nutshell. Basically, CBT is this triangle for how thoughts, feelings, and behaviors are all interrelated. So if you change one, you can change the other. And it doesn't make sense initially, but once you think about it, it makes perfect sense. Let me give you the example about a kid that's acting out in school. Let's say we have Johnny. He's in his classroom. He's always loud, and he's always interrupting the teacher, and he's always tapping the kids on the shoulder and then trying to talk to them. And he gets out of his seat and he walks around, and sometimes he makes paper airplanes and throws them. So Johnny is clearly disruptive. And if the teacher thinks of Johnny of him being obnoxious, defiant, rude, whatever, most likely that thought is going to lead to feelings of anger, which is going to lead to behaviors, probably her being punitive or him being punitive. But let's take the same situation, Johnny kind of being disruptive, and the teacher says to him or herself, oh, Johnny's got ADHD. He's got this neurological issue that really makes it difficult for him to sit still and focus. That feeling, the feeling is now, instead of anger, might be more empathic, and the behavior will totally change. Instead of yelling at Johnny or punishing him, maybe that teacher will say, Johnny, come here. I have to hand these papers out to your classmates. Why don't you go ahead and distribute them? And getting Johnny up and moving and walking around. So the way you think about something, whether you think that Johnny is just a bad kid, unfortunately, teachers think that, or whether you're thinking that Johnny neurologically cannot sit still, the way you think about it changes what you feel and what you do. I just want to give another example because it was so telling. There's one family that I was working with where mom was so frustrated with her 8-year-old child because she has 4 kids, and whenever she'd pull in from the supermarket, her 8-year-old kid would get out of the car and always leave the car door open. And she would say, just close the door. You're 8 years old. You know how to close the door. Close the door. So in her mind, that was a won't. He knows how to close the door. He's just nuts. That's a won't. And she was that led to the feelings of anger. And that led to her behavior. She was basically yelling at him and punishing him. And what we realized was it really wasn't a won't. It was a can't. What happened was that one day the kid had closed the car door on his hands, and now he's terrified of closing the car door. So once we recognize that there's an issue there that's making it can't, you can treat that issue. You can teach them that skill, and then the whole thing changes. So when mom realized that, her feeling was more empathic, like, oh, that makes sense. And she became more nurturing, more supportive, and felt differently, which led to different behaviors. So thinking about it, I'm going to ask you to try to find alternative explanations, and that might help you feel better. And frankly, I don't care if the explanations are true or not, if you're making them up. They might make you feel better. So instead of thinking of either a child or a spouse or a boss as being rude or obnoxious, try to think of an alternative explanation. Like maybe they're having a hard day. Maybe they're not paying attention, or maybe they just don't know how to do something. Any explanation will do, and that might change the way you feel. And if the explanation you come up with, if the alternative is that they don't have a certain skill, then it's up, coach them, teach them how to have that skill, teach them what it is that you need them to do. So if your child is standing there and a peer walks by and says hello, when your child just like kind of looks away and you're horrifically embarrassed, okay, one thing is that you could think of as my child is being rude, but let's think of an alternative. Maybe they're not being rude. Maybe they are just socially anxious. Maybe they don't know what to say. Maybe they didn't see the kid. But if it is something like social anxiety or not knowing what to say, then teach them the skill, coach them, role play with them, give them a script, make them feel more comfortable. So changing the thinking can change the way you feel, and will also change the behavior, because it's going to make you more empathic. That's the feeling, but it also will help you coach them, help them develop the skill.
So is there anything that a caregiver can do to prevent feeling so overwhelmed in general?
Without resorting to the white wine thing? Yeah, yeah, definitely. Yeah. Taking time out is really important. Social support is very important. Being with friends, being with family, enjoying family time. There's lots of research that shows that the more family meals you have, the healthier the family is. So if you could fit in one family meal a week, that's great. 2 is even better. The more you have, the better it is. So try to fit in the time with your family. But to prevent feeling overwhelmed, being organized helps, both at home and at work. Knowing where things are, that just takes another stress off of you, another layer off of your stress level. I know for me that when I lose my car keys, like my kids know not to talk to me because I am not in any condition. So I know that when I come home, I have to put my keys in a certain spot. And when my kids borrow my car, they know they better put my keys back, because otherwise I will lose it. And actually, it's amazing how technology can help, because my kids recently bought me those tile things that beep when you lose something that it's attached to. So that helps. But the point is, organize yourself, know where things are. That can help you from reducing the feeling of being overwhelmed. Routines are important, both for you and for your child, and for your adult. If you're taking care of an elderly person. Routines are very important, but you also need to be flexible. It's not good when some things are so rigid, because life happens and you have to be able to go with the flow. I think that sleep was mentioned before. Sleep hygiene is so important. Making sure you're getting enough sleep. I'm going to tell parents, try to get off the phone at least an hour beforehand. The recommendation is really 2, but I know that so few people are willing to do that. And in terms of kids, I highly recommend that you have your children charge their phones outside of their room. I can't tell you how many times the kids' phones go off at 3, 4 a.m. Kids are texting and tweeting and this and that, and it's not good. So just make sure your phones are turned off, they're silenced, and if possible, get them out of the room so it's not even a temptation. Exercise is important. That should be part of your daily routine. Another thing that's important is just, finding the good stuff, finding the positive things. When we're overwhelmed, we tend to really focus on the negatives. We have to look for the positives, and we have to find them. And we have to appreciate them. So finding the positives is so important. And along those lines, when you see your children doing good things and find the positives in your children, praise them, let them know. It's same thing with the spouse, a loved one. Find the positives and let them know that you appreciate them. And just to throw it in, their diet's important. What we're putting into our body is so important, and definitely has effect on the way that we feel and how alert, awake, the decisions we make. And diet does play a role in all that.
Well, speaking of diet, I'd like to ask Dr. Seminar your thoughts about optimizing nutrition.
Sure. So when you are providing care for an older person, optimizing nutrition is so important to really assure that you are doing everything you can to either recover from an injury, a surgery, or some other comorbid illness. So there are several things to keep in mind, especially for your geriatric patients. One is food consistency. Is the food of a consistency that the patient is able to swallow because of their dentition and their ability to swallow? If patients are not swallowing appropriately, they can aspirate, leading to pneumonia and other complications. So consistency of food is very important. I know that this is a challenge for hospitalized patients who are often put on very highly restrictive consistencies. And when they go home, making that transition and learning how to modulate to get those thickened consistencies for liquids, for instance, can be very, very challenging. There are, of course, certain restrictions which people do have to live with. Most importantly, I would point out to salt restriction for patients with active congestive heart failure. And so that is something that is probably going to be lifelong. So it's important to find other flavors to counteract what people feel like they're missing with salt. In general, I tend to be somewhat liberal with my older patients who have a desire for something that maybe isn't fully appropriate. You know, the diabetic who just has to have pasta on Sundays or who loves to have ice cream on a Monday night in the summer. So I try to sometimes flip it and say, well, if you're going to do that, are you doing the other things that you also need to do in a proactive way? And for most geriatric patients, there's an issue with a lack of protein in diet. One of the syndromes that occurs when people get older is sarcopenia. They can lose a lot of muscle mass, they gain body fat, and in order to appropriately recuperate from injury or illness, they need to increase their protein stores. That's the only way to build muscle. You know, you can't just exercise, you have to lay down the building blocks that you need. So they can get protein from their diet from meat, fish, chicken, and beans. Unfortunately, a lot of people think, well, if I just eat vegetables, I'll be getting my protein. And it's, of course, vegetables are really important for fiber, for vitamins, but you can eat all of the zucchini in the world. It's not going to give you the protein that you need. So education is part of it. And then there are some very readily available protein supplements in the forms of powders that can be sprinkled on foods that people really readily enjoy. Many of them have no taste or flavor and very minimal consistency, actually. The protein powders are significantly improved in that way. So I encourage everyone to, go to GNC and pick the product that they feel would work best for them. There are supplements, and caregivers often ask about the use of, I'll just say Ensure to sort of represent them all. And they can be very helpful for adding calories and vitamins and other nutrients. But if a person has a working GI tract, I don't like to use that as a supplement for food. We can add it in between or as a snack at night, maybe mix it to make a malted with some milk or ice cream to enhance the caloric intake. But if they can eat, I do prefer that they eat food. Socialization is such an important part of eating. If they are alone, they tend not to eat so much. I have so many patients who were socially isolated, had started to lose significant weight. As soon as they were eating meals with family, their intake significantly improved. So think about that as well. And I would also say that if you have a person who has pressure injury risk, there are specific vitamins that can be helpful. So if they have pressure injury, vitamin C, 500 milligrams a day, very important. And also zinc for at least 2 weeks at 250 milligrams a day can also be a very important supplement to take.
Thank you for that. If I can just shift gears for a moment and ask both of you for your thoughts on becoming a caregiver by default. How can a person embrace the role? What can make it easier for them to do so? Either one of you, both of you, what are your thoughts on that?
So I will say that in my private practice, I certainly have had the caregiver by default issue with many patients and or patients' caregivers. And sometimes I'll have a family meeting where some of the challenges can be vented. Often the caregiver by default is more often than not a daughter who's in physical proximity to the parent. Other children may have hightailed it to California and Florida. And, the perception of the person who's behind is that, they left and they're having a great life and I'm not. And so that's where really getting together and talking about what the real needs are is important. For instance, if there are 2 or 3 siblings and only one is providing care, it's not inappropriate to ask the others to make certain provisions. For instance, financial assistance. The person who's providing the care shouldn't by default be the person who has to provide all of the economic support. That may be a tremendous burden for their family. Also, the person providing primary care, I think, has the right to lay down what time they need with their family. It's okay to say, I need 1 weekend free a month to spend with my family. And I don't want to hear from anybody unless that house is on fire or going down, It's okay to take some time. I need 2 weeks every summer. It's going to be at this time. My other siblings, you need to step in and take over that time. And often by asking, you'll receive. If you don't ask, the assumption may be they can handle it. They want it. It's okay. So I really encourage a conversation with other family members who should be contributing and haven't been. And often if you ask, you'll get something. I'm sure, Jill, that you have some recommendations about supportive care and group therapy for these problems too.
No, absolutely. But I think that what you said about asking is so important. So if you have a single parent who's trying to get everything done, it's hard. So you need to ask other people for help. And it might be, your neighbor's going to the supermarket. Can you pick me up a bottle of milk? I mean, that's so helpful. So it's you need to rely on other people, not just for that actual help, in terms of resources, but also rely on people to have fun. Get out there, have some fun, enjoy yourself. You need to take time out for yourself. I know it's very hard to do. In my group, what I do is I do have an assignment where I ask parents to take 15 minutes a week just to do something nice for themselves. And so few people are able to do it. It's so hard to do, but it is very, very important. And if you are caretaking, we know there's a lot that has to get done during the day. I would recommend picking your battles, choosing carefully. So maybe the laundry doesn't have to get done today. Maybe you could do that tomorrow. You can't get everything done. But I think that what you said is that there is help out there, whether it's neighbors, whether it's siblings, but there's also resources such as, within the health system. There's wonderful therapists out there. There's wonderful group programs. So try to seek it out as much as you can. I will say that I think that right now it is difficult to find psychologists that are available. But the bad news is that because so many people are in need, their time is filled. But the good news is that so many therapists are now doing the work on telehealth, which makes it much more accessible. So try to find that help. Try to reach out that way if you feel that would be beneficial.
Oh, that was great. Thank you so much. You've both given such practical and actionable guidance today. I'd like to close by asking each of you for one takeaway that you'd like to emphasize for our viewers. Start with Dr. Sonnenklaar.
Okay. There's so much you could take away, but I think the most important thing would be to basically find and focus the positives in our lives, as we navigate through challenging times and through the challenges of being a caregiver. Find the positives, notice the positives, appreciate them, point them out to others, point them out to yourself, find them.
That's great advice. Jill, it really is a little prayer of gratitude every day, I think can go a long way for sure. I think also that attention to self-care and to what matters most to the patient's health, to them individually, and to their function can really lay the framework for a very successful caregiving experience. It takes some organization. Not everything can be done in one day, as Jill pointed out, but I think that with a positive attitude and with good organizational skills, this can be achieved.
Thank you both so much for all these wise words. And thank you to our audience for taking the time to be with us this afternoon. Have a wonderful day.